push a little bit more. Once I get my pool, I hope to push a little bit more. Have a nice night.
Stan, you've been sitting much too long, much too long. Welcome, 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 welcome to Truth, a radio program designed with you in mind, a program whose sole purpose is to empower you, our listeners, for information leads to knowledge, and knowledge is, I was waiting for you, knowledge is power. And as always, I want to empower you to take control of your life, those things that impact you, your family, and your community. As always, too, I want you to go to the website, www.gwen-truth.com, so you can access all those all-powerful links that will give you the information to make you what? All-powerful. All right, all right, all right. Well, there is a game coming on tonight at 7, and we have a very, very important subject to cover tonight. And it's interesting, Big just had someone on from Halifax Medical Center, and I too have someone who's following, who is a part of the Halifax Medical Health Center, okay? And I'm going to share with you who she is, because we're going to talk about diabetes tonight. That is a very, very important subject. It's a very, very important illness that you need to be sure whether or not you have it, and if you have it, you need to take care of yourself. Now, before we do that, though, I do want to do a shout out. And I'm going to do a shout out to the Domestic Abuse Council. They had an outstanding modeling that went on today, the Red Hat Luncheon, and it was awesome. The police chief was the narrator for the modeling, as you can imagine. It was a hoot. But the clothes that were modeled, I was happy enough to really, and fortunate enough to be one of the models. Outstanding young ladies who were there, in addition to Joy and myself. And the outfits were awesome. You need to really go to the Domestic Abuse Council store, because a lot of the clothes that are there are donated clothes that are new. They are brand new, and you can get them at ridiculous prices. So do support the Domestic Abuse Council, and you know that all of that money goes to help all of those who are domestically abused. All right? So shout out to the Domestic Abuse Council. Now, as I've stated tonight, we are going to talk about diabetes, which is a very, very important issue. It is an issue that if you don't have it, there's probably someone in your family who has it. And we're going to talk about just how prevalent diabetes is. It is an illness, and you can correct me if I'm wrong, but we did have, my husband and I had a very close friend. Many of you knew him. He was very, very involved in the community, Pastor Butts, who had diabetes, and he ended up slowly losing many parts of his extremities, and until he passed. Very, very active, productive individual, you know, until later in life. An awesome man who we miss. But diabetes can strike at anyone. You need to make sure that you got your health in order, okay? So, my guest tonight is Kim, and Kim's going to help me with her last name. I was told Koevenig.
It's Koevenig.
Koevenig, that's what she said. Praise God. I did do it right. Okay, I won't say that I'm going to do it every time, but thank you for coming in. And Kim has been in this profession and related to this profession in terms of helping people to eat right, you know, in terms of the dietitian. It's like the individual who was on with Big earlier, and that individual is a registered dietitian, and she mentioned that you do have to be registered. It protects you, it protects others as well.
That's correct.
Okay, wonderful. And you've been in this business, though, a good 30 years, and as you were saying, 24 of those years has been working with Halifax, and Kim is Diabetes Education Coordinator. So we do want to Wonderful. We do want to have you just briefly tell us about yourself, about those who work with you, and then let's get into the topic of diabetes.
Well, as you mentioned, my background is registered dietitian. I'm licensed by the state and a certified diabetes educator for about 24 years now. I work with a wonderful team. I have 2 registered nurses that help me. One is Sharon James, which many folks know out there in the community. She has worked at Halifax for 40 years. She looks way too young to be there 40 years. I think she started when she was 8 years old. Just kidding. But Sharon handles teaching everybody with diabetes that's an inpatient in our hospital in Port Orange and at the big hospital up here on Clyde Morris and the International Speedway. And then our outpatient registered nurse and certified diabetes educator is a wonderful nurse named Christine Goudreau. And she is just so fun to work with and a wealth of knowledge. She doesn't mind me telling you that she has had type 1 diabetes herself since she's about 11 years old. And so when you work with Christine, you work with somebody that knows from the heart of what it's really like to deal with diabetes. And she is a wonderful, wonderful teacher.
Wonderful. Now, and I know there are people who have heard about, have experienced, are experiencing diabetes and have done so for years. Either they or a family member or some other friend that they know. What exactly is diabetes, number one, and what are the different types?
Well, diabetes is a health condition. It's actually considered a disease where either the body is not making enough of a hormone called insulin, or the body's not using this hormone insulin correctly. And the job of insulin is to lower your blood sugar. It's made by an organ called the pancreas. It sits right under your stomach, and when you eat that food, the pancreas kind of senses it, squirts out the insulin. The insulin kind of helps pick up the food and directs it into your muscle cells and fat cells so you have energy and you're not so tired. So there's different kinds of diabetes. There's type 1, which used to be called juvenile diabetes back in the old days. It's more prevalent in children and young people when they first get diagnosed. And they have a situation where something has basically gone wrong with that pancreas. Something has gone in and destroyed the insulin-making cells, the beta cells. And so those folks can no longer make insulin, so they have to take insulin shots or be on an insulin pump really for the rest of their life to survive. Type 2 diabetes used to be called adult onset diabetes. And this is where you still might be making insulin, but your body's just not using it correctly. It may be resistant to using it. We'll see a lot of times folks that are overweight, not exercising. That's kind of a big thing that may lead to the type 2 diabetes and lead to that insulin resistance. So those folks sometimes can just control it with diet and exercise. Sometimes they have to take pills, but sometimes even they have to take insulin as well.
Now, there are ways that you can, there are symptoms, number one, just to know if you possibly have it because you still want to be tested. And then there are ways that those who may be pre-diabetic can do some things to kind of prevent the onset, right?
Sure. The thing that's really tough for most people is you usually don't feel, about 80% of people really don't have symptoms of diabetes. So there's a lot of people walking around that either have pre-diabetes, which we always used to call borderline diabetes back in the old days, but now they call it pre-diabetes or impaired glucose tolerance. And even people that have full-blown diabetes, but again, don't know they have it. And the only way you're going to know is go to the doctor or go somewhere where you're going to get your blood tested and screened. They're going to check your glucose, or they have a special test now. It's called the A1C test. It's a tattletale. It'll tell us what that sugar has done 24 hours a day for the last 3 months and kind of give us an average. And if it's a certain number, then the doctors know, okay, you either got the pre-diabetes or the diabetes, and hopefully you don't have any problem at all.
Now, when they test, would they automatically do that one, or is that one done just with those who have maybe that in the family history or whatever?
The A1C
Yes.
test, yeah, that's not always routinely done. So doctors a lot of times will start looking at the fasting blood sugar. The glucose is what the name is on the test, and if they see that creeping up, they might then test for the A1C. You know, it's always something you can ask the doctor for.
Mm-hmm.
I know at our hospital they're doing a new Renew You, trying to get all the employees healthy. We're so busy taking care of everybody else, we don't always take good care of ourselves.
That's
and
true.
So they've been screening all of us, and I know we picked up some folks that didn't know that they had any blood sugar problems by doing that A1C test.
Mm-hmm.
So it's a good test to ask for, and the doctor can tell you if it's appropriate or not for you.
And you said that there's so many people who have it who have no idea that they do because there aren't a lot of symptoms that are tied to it. Are there any symptoms?
There are some symptoms. The classic symptoms are you start to get a lot thirstier than usual, like almost you can't quench your thirst, and then you're going to the bathroom a lot, urinating a lot, and then you might be tired. Some people, they'll have extreme hunger and in fact be eating a lot, but they may end up losing a lot of weight, especially with type 1 diabetes. It's not uncommon for us to see people come in, they'll lose like 20 pounds in like a week or so.
Oh, wow.
It's very quick weight loss. We don't always see that weight loss with the type 2 diabetes. But a lot of times folks will be hungry, eating a lot, still tired. A lot of times their vision changes. They have little cuts, wounds that are taking a lot longer to heal up. So those are some of the classic symptoms of the diabetes.
So if you notice, because I know there are some general tests usually they will ask you when you're taking a physical or whatever, and if you've then lost weight, not trying, you just lost a lot of weight,
Right.
yes, or you find that you're thirsty a lot or you're hungry a lot, those should be like warning signs.
They can be.
Yeah,
And they
yeah.
might, but really you won't know
You
unless
won't know
you
until
do
you
the
do
test.
the test.
Yep.
Do the test. That is
Yeah.
key and important. Now, we've heard because now, are there groups, racial groups that have a higher incidence of diabetes?
Well, yeah, sure are. I mean, truly anybody can get it.
Mm-hmm.
But there's definitely a higher risk in African American, Hispanic, the Asian American population. So those are some of the top ones. And then American Indians, American Native Indians are very high risk. We don't always see that as much here in Florida, but a lot of folks in the Midwest part of the country and the western part of the country, they'll see a lot of diabetes in that too.
Wow. Now, is that based on diet or
Nope, it's just something genetic. So
because, and I'm going to tell my husband, he doesn't have it, but I keep telling him not to keep eating that fried chicken and all those fried foods and the like. His mother tells him the same thing because she's a real, I'm going to call her health nut, but she is. But are there special things that you should, if you're pre-diabetic and even if you're diabetic, are there special diets that you should, steer clear of or make sure that you eat plenty of?
well, it's kind of a couple different scenarios. For pre-diabetes, there's actually a great national program out that our local YMCAs are part of. It's the Diabetes Prevention Program.
Yes.
And so the strategy, if you are at high risk or you've actually been told you have borderline or pre-diabetes, is to eat low fat. It makes sense not to eat a lot of simple refined sweets, but the big thing is they do low fat, watch the calories. The big thing is weight loss and exercise. That's the big strategy for that, and consistent. Just don't do it for a week and give up. You got to keep with it. For diabetes, though, our big focus is definitely, certainly weight management is a thing, but the carbohydrate intake is the big focus. We teach how to count carbs. Carbohydrate foods are your starches, fruits, milk, yogurt, and of course sweet beverages. And there's a certain amount of carbs that you want to try to stick to. When you sit down with a person that's a registered dietitian like myself, I can do the calculations and figure out exactly how many carbs you need. But just to give you folks out there a general idea, let's say you're a woman and you're a little overweight. You would want to try and keep your carbs probably between 30 to 45 grams of carbs at every meal. You want to try and eat 3 good meals a day, space them out about 4 to 5 hours apart. And any snacks you have, you keep to about 15 grams of carbs. The reason you watch the carbs is that's what changes to the blood sugar, about 100%.
Okay.
The protein foods, the fat foods, that doesn't really convert to glucose or your blood sugar that much. If you don't need to lose weight so much, then ladies, you could do kind of 45 to 60 grams of carbs. Now you gentlemen out there, you get more than us ladies. Y'all have more muscle than us. So usually most men can do about 45 carbs to 60 carbs for weight loss. If you don't need, and that's per meal, and snacks would be between 15 to 30 grams of carbs. And then if you don't need to lose weight, usually most men will do pretty good with their sugars if they stay between 60 to 75 grams of carbs per meal. But everything's individualized. I have a lot of men, they love to do high protein, low carb. So, you know, I work with them on that too. You need a baseline amount just to keep your brain healthy and give you energy, and prevent low blood sugar.
Yeah.
Even though you have diabetes, it doesn't mean your sugar's always high. Sometimes with diabetes, your sugar can swing right around and drop too low.
Oh, okay. Okay, wonderful. So it's good to actually have that glucose tested at the count.
Right. When people are told they have diabetes, most of the time their doctors will advise them to test their blood sugars. You know, when you go to the lab for your checkup every 3 months or 6 months, you know, that's just telling you what your sugar is kind of more for that point in time, or even the A1C is just an average. But the good thing about testing at home is you can kind of from day to day see the impact of foods on your sugar. A lot of people don't know that stress makes their sugar go up. If you don't get enough sleep, that can make your sugar go up. Let's say you have a lot of pain, you have a horrible foot pain or back pain, that kind of stuff can make your sugar go up. Sometimes other medicines you're on can make your sugar go up. So there's a lot of things, and you learn a lot about your body and how it reacts to different foods and activity and sleep and stress once you start testing at home. And you can catch problems. You know, we have a lot of people that'll come in our hospital, even this week, that, you know, sometimes they'll have sugars, you know, in the high 100, you know, like 600, 700, even over 1,000. And, you know, if you were testing at home, you could catch it and hopefully get some help before you end up landing in the hospital emergency room.
And it's important, I think, for people to know, because they hear people talk about diabetes, you know, and they're still a family member, they're at a cookout or something, somebody's saying, you know, you're diabetic, you shouldn't be eating this, or you need to eat some sugar, or you need to do this, that, or the other. And there are a lot of people who, when they're out, if they're diabetic, they'll say, oh, it feels like my sugar's going down, I'm getting tired or whatever, I feel like I'm getting ready to pass out. And then they'll eat candy or something. Is that recommended then?
It actually is. If you are having a low blood sugar and the symptoms are you get weak, shaky, lightheaded, extreme quick onset hunger, a lot of times your personality can change. If you know somebody that's normally very sweet as pie and all of a sudden they turn into a grizzly bear, mean and grumpy, a lot of times it's that sugar dropping low. Some people break out in a cold sweat. What's happening is the brain only runs off a certain amount of sugar, and when it doesn't get it, it drops too low, which for most people, the cutoff nationally is 70 or less than 70 on the blood sugar reading. Then you for sure need to get some kind of quick-acting sugar in it. It could be half a cup of fruit juice, half a cup of soda, it could be 3 peppermints, it might be 4 lifesavers. Something that's just pretty much straight sugar, tablespoon of honey, tablespoon of regular jam or pancake syrup, 4 little packets of sugar from the restaurant. That'll work too. So something like that will work.
Now you just mentioned something that I was talking with someone from car dealership recently, and he was saying, even in terms of fighting colds and all this kind of stuff, that honey is good. Is honey good? Honey?
Well, it's not really good for diabetes.
Oh, okay.
Because it's sugar.
Yes.
That's why.
In fact, the more natural it is, the...
No, sugar is sugar, so, you know, it might have a few more little nutrients in it than white sugar, but it's still got the same amount of carbs, and it's still going to make your blood sugar go up. So all you out there that are having colds, because I know it's going around, and you're thinking, well, I need to have a bunch of tea with a lot of honey.
That's right, yeah.
It's probably going to make your sugar go up.
Oh, so you might help with one thing, but then you're going to worsen something else.
Right, and you have to remember when you get sick, your sugars already are going up.
Wow.
Mm-hmm.
What I started to get into, though, as I was mentioning about our friend who lost, fingers and toes and the like, it's not, diabetes is not something that you want to play around with. It's not something that, a lot of people will joke or whatever about, I'm gonna eat this fried food and I'll do whatever I need to do for my diabetes later or whatever, or I'm gonna eat this big piece of cake or whatever. And the truth is that we who love the individuals who are diabetics, we should be making sure that they stick to, and we know it's difficult for people to do 100% of what they should do, and maybe you let them have a little bit of something every so often or treat themselves, but we really should be helping these individuals if we love them, because this is a serious business. There are people who die from it, people who lose their extremities, their toes, their fingers and the like. I had a cousin who died in her 40s, late 40s. She was always on dialysis and the like, and she went for dialysis, and something happened with her system, and her heart gave out. And she left several kids behind. I mean, it's serious. It is serious is the point I'm making, right?
It absolutely is. And I think what's really difficult for people that, especially that have diabetes, is you really can't feel it. And it's hard to tell just by feeling if your sugar is high. I mean, so for a lot of people who are just maybe in a little bit of denial and just say, well, I don't want to fuss with it, it's not bothering me, it's very sneaky, and it can catch up with you if you do not keep it under good control, and you have diabetes long enough. You already are at 2 to 4 times increased risk for heart attack or stroke. When you have diabetes to your body, it is like you've already had a heart attack. It's a leading cause of blindness. It's one of the leading causes of kidney failure, ending up on dialysis. Neuropathy, which is problems with the nerves. You'll hear a lot of people say, man, my legs are hurting so bad, they're feeling all tingly and feel like pinpricks, and then they go numb. And that's a bad thing, because eventually that can lead, if you lose a feeling in your feet and then you step on something and you don't know it, it gets infected, and that leads to that amputation, like your friend that had lost parts of leg or whatever. And I sure hate to see that in anybody. But you're not. I also say you're not doomed to having complications of diabetes. Christine, our nurse, is such a wonderful example. I know many people who've had diabetes for years, and a lot of people say, oh, type 1's a lot worse than type 2. Neither one of them are good, okay? Right. But you are not doomed to having a complication, and I've seen it with my own eyes. If you take good care of yourself, you do not have to end up having complications of diabetes.
Now, you mentioned exercise. Besides watching what you eat, having a good weight management type of a program, because many of the diabetics that I've seen do have weight problems. Is this common, or is it just the people I'm seeing and know?
Well, here's the deal is, I mentioned earlier there's 2 different kinds of diabetes. So type 1, only about 10% of folks with diabetes have type 1. The majority of other folks with diabetes, type 2, 90% just about is going to be usually folks that get this a little bit older in life, and being overweight is definitely a risk factor for it, one of the leading risk factors for it. So, that's definitely a problem, and that's why you see it more, because that's just the more prevalent kind of diabetes, and Americans in general, we all struggle with our weight. In terms of exercise, though, what the guidelines are for diabetes, they want you to just try to get a little bit of exercise in most days of the week. The ultimate goal is 150 minutes a week. When you break it down, it's about 20 minutes a day or about 30 minutes 5 days a week if you want to take Sunday off or whatever. And you don't have to do it all at one time. If you just say, well, my back hurts, okay, maybe just try and go out of your house and walk 5 minutes out and 5 minutes back, but do it 3 times a day and you got your 30 minutes in. So you do what you can, and more they're finding it's, if you can just be active in your daily life. You know, a lot of folks will say, well, I can't do formal exercise, or I can't go to a gym, or this and that. Just try to be more active in your daily life. That will help. Get out and walk your dog. When you go to the store, don't waste 15 minutes looking for the closest parking spot. Park further back and walk.
Right.
You know, take the stairs when you can. You know, if you're physically able to do that. So little things like that, they add up. And you know, even when you're watching TV, just you know, get up during
leg
the
lifts or whatever.
just a little something during commercials. You can do that. So it's not overwhelming. You know, I think everybody can do it, but I think you know, a lot of times we're not consistent. I have to confess to that myself. And get busy and kind of push it off. But I think if we start thinking, all right, let's just do it in little increments. Every little bit helps, then we're more likely to get to these goals that we need to get to.
Absolutely. Now, of the people that you, as education coordinator, with different ones going out and talking to individuals who either have the potential for becoming or are diabetic, do you find, and I asked you this earlier, that people listen to the advice or recommendations or suggestions that are given, or you know, do they really take it serious?
Well, some do and some don't. My experience over a lot of years has been it usually takes getting scared to create a change. So, you know, I had somebody in my office, you know, this week, you know, that's lost 70 pounds, you know, and he knew that he had to do that, you know, to help with his job. You know, I've had tremendous results, and people that just absolutely turn their life around, and they actually feel better. They almost feel like getting diabetes has been a blessing, because it's changed them away from a lot of bad habits. Maybe it was drinking alcohol too much, just eating junk food, you know, sweets all the time, drinking too many sodas all the time, and now they're exercising, eating healthier food, and so they see it as a positive thing. But you will certainly always have a lot of folks that'll just say, well, you know, blah, 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 I don't want to listen to that old dietitian, and I'm just going to do what I want. And that's fine, but you will pay the consequences. You are not hurting me, the educator, when you don't do what we tell you to do. You're hurting yourself. And you ultimately, you know, kind of hurt your family, because they care about you.
Absolutely.
And if you're not around and you're disabled, you know, you're going to miss out on some precious time and moments in that life.
And things that you could have been continuing to do, now you can't do, because you were kind of hard-headed and stubborn, and you know, didn't do what you needed to do to be able to continue to live an active life. Now, we talk about sugar and, you know, the purpose of, you know, with the glucose and all. Now, people go into the store and they see low sugar this and, you know, low sugar that and whatever. How truthful is the advertising when it comes to that type of stuff? If you're there grocery shopping and you're trying to get something that is going to help you.
Yeah. You know, sometimes you're right. That can be a little bit deceiving. And when I teach our diabetes classes, I teach the nutrition part. I bring in a lot of packages of food and let folks look. For example, we have 2 kinds of cookies. They're by the same company. One's sugar-free, one's regular. And that company is expecting people just to focus on sugar grams. But that's really the wrong thing to look at on a food label. Don't look at the sugar grams. You look at the total carb grams. All right? And when you look at that, you'll see, well, doggone it, those sugar-free cookies, they actually had more carbohydrate than the regular cookies. And they were more expensive. They didn't taste good. What happens is a lot of times the food companies will take the regular sugar out but put a different kind in. It's called a sugar alcohol. This is stuff like sorbitol, mannitol, xylitol. And the reason they do that is because this sugar is digested slower in the body, which can be a good benefit. Your sugar might not jump up so high so fast. So that's a good thing. But unfortunately, it can have a side effect of a lot of gas, bloating, and diarrhea if you really eat too much. So most people are like, oh, I don't want that. So for me to tell somebody to have that kind of a product, it would really have to be significantly less carbohydrates to make it worthwhile and also worth the money. You know, a lot of the sugar-free chocolates are going to have, they'll advertise, they'll put that it has Splenda in it, which is okay for diabetes, but if you read the fine print on the back, in addition to that, it still has sugar alcohols. So I was showing a person that today, and you know, she was really surprised. She's like, wow, you know. So the Diabetes Association now, and when you get the nutrition booklets that we give you, you'll see it has real desserts. We show people sometimes how to work in chocolate or birthday cake or your ice cream. We don't take everything you like away. Okay, the registered dietitian is a master at maneuvering and showing you how to work in some of your favorite things, but the key is moderation.
Right.
You can't sit there with a whole bag of Hershey Kisses and eat it and expect to control your sugar. You know, if you can keep it to 5, that's 15 grams of carbs. That could substitute maybe for a piece of bread. You know, give up the bread and have your 5 Hershey Kisses, and you've at least kept your carbohydrates consistent. I'm not going to tell you it's better than the bread, but at least it solved that craving that you had for the chocolate.
Now, we were talking to start off with too about diabetes being a part of your family history. Those who have family members who are diabetics, will they necessarily become a diabetic?
You're not doomed, but you're definitely at higher risk for sure. So if you have a blood relative, you know, a parent, grandparent, brother, sister that has it, you need to keep in the back of your mind that you are at high risk for this, and you need to be diligent about, you know, getting screened on a regular basis for diabetes or prediabetes.
And apparently you can be in the best of shape and you'll still become a diabetic. You have an event coming up with an individual who's a former.
Oh, well, thank you for
bringing
bringing that up.
Yes.
That's true. You know, we have a wonderful opportunity coming Wednesday, March 5th to Halifax Health. We actually have a former pro football player from the Pittsburgh Steelers. He won the Super Bowl. Ironically, I was reading this in 2005. They beat the Seattle Seahawks. So anyhow, what's really neat about this gentleman, his name is Kendall Simmons, and this football player, he developed type 1 diabetes when he was on the team. And with the help of his doctors and a good healthcare team, he overcame, you know, any obstacles to having diabetes, and of course, being type 1, he's on insulin, and really continued to have a very successful career for many years. He also worked for the New England Patriots, the Buffalo Bills, but the Pittsburgh Steelers were his main team. And he's coming to Halifax to share his story and encourage and motivate people with diabetes. He'd love to have children and youth there, you know, athletes, but people of all ages. Even if you just want to see the Super Bowl ring and get his autograph, come on down. It's going to be from 5 to 6. It'll be in the newer France Tower. We have some nice meeting rooms there. We'll have some snacks there because it's going to be about 5 o'clock. It won't be a full dinner, but at least a little something to tide you over. And what a great opportunity to hear his story and get motivated to take care of yourself.
Yes, yes. Now, and one of the things you mentioned that when you have diabetes 1, you will be on medication for the rest of your life.
Yeah.
Those who have diabetes 2, are they also, I don't want to say doomed, but are they going to end up being on medication for the rest of their lives too, or are there ways that they can actually get control of it and live more normal lives?
Well, I think you can definitely live a normal life with diabetes, but I think what you're getting now, you know, ask me is about the medicine, and so in my experience, I have seen people with type 2 diabetes who have been able to get off medicines, but it's usually in folks that were very overweight, and then they lost a lot of weight, and they were very consistent with exercise. We also know that one of the big treatments now for type 2 diabetes in folks that are considered obese is weight loss surgery, the bariatric surgery. That is now actually recommended by the American Diabetes Association to, if you want to say cure, it's one of the main treatments to basically, I'll say, kind of get rid of diabetes. It's not a guarantee, but a lot of folks will get off their medications with the weight loss surgery. And that's not me saying everybody needs to be on that, but it's a discussion if you've really struggled with your weight and you have this disease, and even if you have other diseases along with it, high blood pressure, heart disease, you know, it's something to at least have a conversation and get information about. But what we do know is diabetes is progressive, and there are a lot of people, despite doing everything right, they will end up on insulin. It doesn't mean necessarily that you did anything wrong. It just means your pancreas pooped out on you. Just as, you know, different parts of our body get kind of old and tired, sometimes it's the pancreas. And you can't beat yourself up about that. A lot of doctors will say if you have diabetes long enough, 20, 30 years, eventually you may end up on some kind of medicine, and it may be on insulin.
Now, what you offer, the three of you, to the community, is that available to anyone, everyone? And share that, and then how someone can get in touch with you if they're interested in having someone come and do a talk or whatever.
Okay, well, here's how our program works. We have a program that is basically certified. It's called a recognized program by the American Diabetes Association. So we have some pretty strict standards that we have to follow in education. So we work by physician referral, but don't let that stop you, because you can call us up, we can get the referral, send it over to your doctor on your behalf, and we have classes at the hospital, and we work with people one-on-one. Everybody gets to come in and work with us individually before they start the group classes. We have individual nutrition counseling sessions. This is going to be set up for folks that have health insurance. Now, what if you don't have any health insurance? We still have something to help you. We have a little bit of donation money, grant money. We also have a special program for folks on the patient assistance program. We have a 4-hour workshop. So, you know, when you're in that situation, you may not get all the one-on-one appointments, but at least we have a 4-hour workshop. You still get all the same great handouts and information you would at the other classes. So we have something to help everybody. And as far as going out, we don't take these classes out to the community. They have to be hospital-based, but we do go out and do some community talks. You know, we all try to do that from time to time as our schedule allows, and we try to have some programs, again, in general community programs at the hospital, like this one coming up on March 5th with Mr. Simmons.
Now, how many diabetics are there in our area and nationwide?
You know, I don't know the exact number here in Volusia County. I can tell you that nationwide there's about, they estimate about 26 million people with diabetes, and of that, about a little under 19 million know they have it, and they estimate the rest don't know they have it, but they're walking around with it. And about 79 million people that have pre-diabetes. So the scary statistic that's been coming out is they're thinking that by the year 2050, every 1 in 3 people in the U.S. may have diabetes, because we have so many folks with pre-diabetes are going to end up converting to full-blown diabetes.
I've also heard that more children are being diagnosed with it, correct?
Yeah, more children, and you know, and we're seeing more children that have the type 2, what I said used to be the adult onset, and that's a lot of the reflection of more children being overweight in our country now.
So we need to, as Americans, good Americans. We need to start eating right. We need to start doing some exercise. And from what I gather more lately, people who talk about exercise talk about mixing it up. If you, rather than walking every day, walk this day and then the next day you might do some stairs or some whatever, and then walk the next day or whatever, mix it up a little bit. But it's important to educate yourself on whatever it is that you have or may have, or whatever it is that you need to do to make sure that you're as healthy as you can be. Because, you know, I've heard someone say to me, and this was an elderly person who said that, you know, if you don't have your health, you really don't have anything, because there's so much, you're so limited and pretty much in a box when you can't do what it is that you want to do as an individual who is no longer healthy and really and truly now more dependent on other people. And I can't believe that more people would want to be that way, but they end up by default getting there because they don't follow through on what it is that their doctors or others are saying that they need to do. In what you've read, in the people that you've seen and the like, what are some of the are there some ideas out there or beliefs out there that people have in terms of diabetes that's not true?
Well, I think a lot of people think that you can get diabetes from eating sugar, and that's probably one of the biggest fallacies. You can't drink a Coke or have a Snickers bar and that doesn't cause diabetes.
Mm-hmm.
So it's something that is often progressive, and you know, type 1 they think is autoimmune. They're even looking into viruses now attacking the pancreas and causing type 1 diabetes.
Oh,
so
wow.
they don't know all the mechanisms of type 1.
Mm-hmm.
But, you know, just because you eat sugar doesn't mean you're going to get diabetes. And not everybody that's overweight or obese is going to get diabetes
Mm-hmm.
either. So I think that's a big fallacy. I think there's a lot of people that come in and say, you can't eat anything white when you have diabetes. I hear that a lot. And honestly, that's not true either. I try to tell folks, you know, cauliflower is white and you can have that, that's low carb, and chicken and turkey, that's white meat, and that, you know, you can have that. I think when you have your doctors tell you, you know, try to stay away from the white food like white bread, white pasta,
Mm-hmm.
and white rice, doctors don't have a lot of time to counsel their patients anymore. They're so busy and trying to, you know, help you with so many problems. And so they're trying to encourage you to do more whole grain stuff, because they know the more fiber you get in your diet, that's going to help keep your sugar from hopefully jumping up so high so fast. And it's just more nutritious for you, so it can help cholesterol too. So, you know, but the reality is, whether you have a white potato or a sweet potato, the carbohydrate content is the same. It's just
really?
The sweet potato is more fibrous. It tends to have what they call a lower glycemic index.
Oh, okay.
Whether you have white rice or brown rice, the carbohydrates are the same. Same with the white pasta, the brown pasta, the whole wheat pasta, the carbs are the same. So I think what sometimes makes me crazy is I'll have folks that will be so afraid to ever eat a piece of bread or a potato, they cut back on their carbohydrates too much, and then they end up
Mhm.
with the low blood sugar. So I'd rather you eat the correct amount of carbs. You know, when you have the choice to do more, the brown, the whole grain stuff, go for it. It's certainly a lot better for you, but also know that the most important thing is to get the proper balance in.
Mhm.
And that's something that we can help you with when you meet with a dietitian or our certified diabetes educators.
Now, I know you're a registered dietitian, so you probably answer yes to this, but I would have a quick question as to whether or not it would be a good idea for people to actually get with dietitians to, if they're not sure about quite what to eat, etc. And I know there are actually some places where they have weight reductions and the like, where they actually have registered dietitians, hopefully they're registered, that work for them. Is it important to have someone really to help you develop a plan?
It is, you know, the nice thing about working with a registered dietitian is you're gonna get somebody that's not gonna give you a bunch of quacky, you know, information. And we know how to, really tailor the diet to you. Like I said, the big trend now with diabetes care and all health problems is really individualized.
Mhm.
So your diet can be individualized. We know the calculations to figure out your metabolism and the right amount of carbs, pro and fat in the diet. So, but that doesn't mean, you know, there's other good programs out there, you know, to help people with weight reduction as well. I'm not saying a registered dietitian's the only one that has to do it, but I'm saying that you will get a good quality plan that you can live with as a rule of thumb with a registered dietitian.
Well, it looks like they've arrived. It's time for us to go off, but I do want to thank you, Kim Koevenig, for coming on with Halifax Medical Center. And Kim, again, is a diabetic education coordinator, diabetics education coordinator with Halifax. And the information has been very, very helpful. And what's key and important, guys, is that if you're not sure, check it out. Talk with your doctor if you think you have symptoms. If you really know you have that history, you need to get the tests that are necessary so that you can be sure. Thank you, thank you, thank you. Great information. You've been listening to Truth with Gwen Azama-Edwards. My guest, as I've mentioned, Kim Koevenig with Halifax Medical Center, who is the diabetics education coordinator. And be sure to go to the website, www.gwen-truth.com. Until next time, you guys stay informed and be empowered. And do that, continue to stand for that which is right and truthful. Until next time, Gwen Azama-Edwards with Truth. God bless.
Your host, Gwen Azama-Edwards.
I forgot to give a phone number.
Go ahead and say it.
1380 Radio, Ormond Beach.
Our phone number, if you need to call for diabetes ed, is 258-4829. That's 258-4829.
Okay.
Thank you.
Thank you. 258-4829.
Yep.